Xanax, the brand name for alprazolam, is a short-acting benzodiazepine. When used in small doses for short periods of time, it can be a genuinely helpful tool for treating anxiety and panic disorder. But here's the problem. Its use can lead to physical and psychological addiction, and when someone stops taking it, the withdrawal symptoms can be severe, and in some cases, life-threatening. If you or someone you love is struggling with Xanax dependence, call 800-671-4304 right now. Specialists are standing by to help you find a licensed detox program near you. So let's talk about what Xanax withdrawal actually looks like, when it starts, and how to get through it safely. What is Xanax withdrawal? When a person takes Xanax regularly, the body becomes physically dependent on it. So when they stop, the body reacts to the absence of the drug, and that reaction is withdrawal. Symptoms can range from mild to severe, and they vary from person to person, but several symptoms show up consistently. Here are the 5 most common Xanax withdrawal symptoms. Number 1, anxiety and rebound anxiety. One of the earliest symptoms is anxiety. It typically begins within 6 to 12 hours after the last dose and can include restlessness, racing thoughts, panic attacks, and an overwhelming sense of dread. For people who were originally prescribed Xanax for anxiety or panic disorder, this can be especially difficult because rebound anxiety can actually be worse than the original symptoms. These symptoms usually peak around day 2 and begin to resolve within 4 to 5 days. On average, rebound anxiety clears up within about a week. Number 2, insomnia. People going through Xanax withdrawal often struggle to fall asleep, wake up frequently throughout the night, and experience restless dreams and night sweats. The sleep deprivation then makes anxiety and irritability worse, creating a cycle that can extend well beyond the acute withdrawal phase. Number 3, flu-like symptoms. Xanax withdrawal can feel a lot like having the flu. Sweating, chills, headaches, muscle aches, fatigue, nausea, and diarrhea. These symptoms generally resolve around days 5 to 7. But it's important to stay hydrated during this phase, because dehydration left untreated can lead to dizziness, seizures, kidney failure, low blood pressure, confusion, and in the most severe cases, death. Number 4, depression. Many people withdrawing from Xanax experience significant depression. This can show up as hopelessness, loss of motivation, irritability, and in some cases, suicidal thoughts. These symptoms occur because Xanax affects 2 key brain chemicals, GABA, which is the brain's main calming neurotransmitter, and serotonin, the feel-good transmitter. Both are responsible for mood and stress regulation. Once the brain has had time to rebalance these chemicals, depressive symptoms typically improve. In some cases, antidepressants like SSRIs may be used to help manage this during withdrawal. Number 5, physical pain. During the acute phase of withdrawal, people often experience a mix of painful physical symptoms, including head pressure, muscle stiffness or cramps, jaw clenching, and back and joint pain. Over-the-counter medications like ibuprofen or acetaminophen can help, as can supplements like magnesium glycinate or Epsom salt baths. Beyond the 5 most common symptoms, Xanax withdrawal can also produce a range of other symptoms including headaches, light sensitivity, blurred vision, mood swings, loss of appetite, tremors, seizures, hallucinations, delirium, heart palpitations, and high blood pressure. Some individuals also develop what's called post-acute withdrawal syndrome, or PAWS. This happens when the brain is still working to heal and regulate neurotransmitters, especially GABA. PAWS symptoms can include persistent anxiety, depression, mood swings, irritability, sleep problems, fatigue, and cravings, and they can last for weeks or even months after the acute withdrawal phase. So when does withdrawal actually begin? Xanax withdrawal typically starts within 6 to 12 hours of the last dose. The most severe symptoms usually hit between days 2 and 4. And most people find significant relief after 1 to 2 weeks, though those who develop PAWS may experience symptoms for much longer. Now, not everyone experiences withdrawal the same way. Several factors affect how severe it gets. How long someone has been using Xanax. Using it for more than 3 to 6 weeks increases the severity of withdrawal. Whether they use immediate release or extended release, the immediate release form tends to produce more intense symptoms. Age and general health. Older individuals and those with underlying conditions may metabolize the drug more slowly, prolonging withdrawal. Whether other substances are involved, combining Xanax with alcohol, opioids, or other sedatives significantly increases the risk of complications. Whether someone stops cold turkey or tapers, abrupt cessation dramatically increases the risk of seizures and other dangerous symptoms. Genetics and liver function. Poor liver function slows drug clearance and can extend the withdrawal timeline. Mental health history. Co-occurring conditions like anxiety, depression, or PTSD can worsen during withdrawal, increasing the risk of relapse or self-harm. And past benzodiazepine use. People with a history of prior Xanax withdrawal or other benzodiazepine use may experience more severe or prolonged symptoms. Let's talk about why stopping cold turkey is so dangerous. Going cold turkey is not just extremely uncomfortable, it can be life-threatening. Here's why. As a person uses Xanax over time, the brain gradually reduces the amount of GABA it produces on its own. When Xanax is stopped suddenly, the brain doesn't have enough GABA to maintain calm activity, and that imbalance can trigger seizures. For long-term or high-dose users, the risk is even greater. Sudden withdrawal doesn't give the brain time to adjust, which can lead to grand mal seizures that can be fatal. Other life-threatening symptoms from abrupt withdrawal can include dangerous blood pressure changes, heart palpitations, delirium, and hallucinations. So what is the safest way to come off Xanax? The answer is a medically supervised taper. The general recommendation is to reduce the dose by 10 to 25% every 1 to 2 weeks. This gives the brain time to gradually adjust its neurotransmitter production and significantly reduces the severity of withdrawal symptoms. Some people benefit from switching from fast-acting Xanax to a longer-acting benzodiazepine like diazepam or Valium. Because long-acting benzodiazepines are taken less frequently and can be tapered in smaller, more controlled steps, this approach gives the brain more time to adjust, making the process safer and much more comfortable. Beyond tapering, there are several other coping strategies that can help. Talk therapy or cognitive behavioral therapy. Good sleep hygiene, including darkened rooms and limiting screen time before bed. Staying well hydrated and eating nutritious food. Journaling or joining a support group. Medications like antidepressants or anticonvulsants when appropriate, and avoiding other sedatives including alcohol. Finally, when should you seek immediate help? If you or someone you know experiences any of the following during Xanax withdrawal, seek medical attention right away. Suicidal thoughts, hallucinations, seizures, or heart palpitations. These are medical emergencies. Don't wait. A medically supervised detox program offers around-the-clock monitoring, early intervention for severe symptoms, and an environment where outside triggers are minimized so you can focus on recovery. Many programs also offer addiction education, therapy, and peer support, all of which are critical for long-term sobriety. Recovery from Xanax dependence is absolutely possible, and asking for help is the first step. If you're ready to take that step, call 800-671-4304 right now. Specialists are available to help you find the right detox program near you. You don't have to go through this alone.